versus venous ulcers. All right. So if you have peripheral artery disease, look at me on paper. What are your assessments going to look like on this patient's legs? All right. So pulses may be diminished. It's going to be a cold, dead leg. What are some other adjectives we'd use to describe it? Pallor, shiny, hairless, taut skin. Taut. Taut. Yes, we don't taunt it. Haha, stupid cold leg. All right. So arterial ulcers, okay, are because you're not getting blood flow down there. Yes. All right. What I gave y'all here, you have got to know all these characteristics because usually get this in a select all that apply. So can you read the slides? Yes. Yeah. All right. So patho for arterial, it is obviously caused by ischemia. There's no blood flow, right? Location. It's pretty much everywhere except for the ankle. Because if you look at venous, venous is ankle. Arterial is like everywhere else. Okay? Because you'll know everybody has like one big giant vein on this bone on their ankle. Do y'all have that? Everybody has one. Okay? So that is a vein. Everything else would be arterial. Okay? It looks like a hole punch. Like somebody just went like, okay? It is deep. It is painful. It is they'll call it demarcated borders, which basically mean like a hole punch. Like it's perfect, like a hole. Okay? There's not a ton of drainage, right? Because remember, Venus is the one that's sitting in water. Okay. So the pulses would be decreased or absent. We said it's shiny, taut, hairless skin. Yes. Yes. All right. The foot is cold and dead, right? Decreased sensation, increased cap refill, weak pulses. Y'all with me? All right. Every day they're supposed to look at their feet with a mirror. Okay. They may need antibiotics if those get infected, which a lot of times they do because you can't get blood flow down there to get your white blood cells to kill it off this infection, right? And most of the patients that have PAD also have diabetes, which means their blood is full of sugar. So whatever blood is going down there, yeah, that bacteria is like having a heyday on that sugar. Analgesics, maybe not opioids or anything like that, but for like, hey, if this hurts really bad, maybe some NSAIDs or something. Okay. How do their legs go for arterial? Down. And then y'all know what to do for arterial, right? Right? All right. Like quit smoking, firm soled shoes, no flip flops. Y'all know these. Yeah. I don't need to go over this with you. Okay. They're not supposed to go barefoot because God knows, what could happen. All right. Venous ulcers. Remember, these are wet and weepy, right? They're on the ankle. Okay. Anywhere on the ankle from like lower calf all the way down to ankle. They're shallow, superficial, wet, weepy. They're kind of crazy looking and they're just constantly oozing. All right, y'all remember what the skin looks like, right? I showed you a picture. It is dry, leathery, flaky. They usually have varicose veins, right, along with it, but they have pulses because it's a venous problem, not an arterial problem. So their leg is warm. Their pulses are normal. Cap refill, normal. It's just kind of itchy and flaky, okay? They may need some antibiotics if it gets infected. These may eventually need debridement because it can never heal because it's just wet all the time. You know what debridement is, or we cut away the gritty tissue. Sometimes they get so deep that they need skin grafts. That's bad, y'all. And then it's hard for the graft to take because there's very little blood flow, right? That's great. They're getting good arterial blood flow, but they can't get all that stuff back up. So it just sits in there. Yeah. All right. You want to elevate their legs. Yes. Watch for signs of cellulitis. What's cellulitis? Inflammation of the skin, right, where it gets infected. Okay. You're going to use a non-occlusive dressing. What does non-occlusive mean? Where it's open and can breathe? Yeah. Well. Oh, which one? Huh? Where it's closed only. No, that's for a chest tube. So non-occlusive means it doesn't stick. So you need something like, have you heard of the Teflon, like the Teflon pads? You know what I'm talking about? Where no, because it will stick. Think like if you put gauze on something that's a little bit wet and then it dries and then you pull it off and it just rips off the skin. So you need the Teflon pads. They look like this. They're this big and they almost look kind of, thank you. Okay. They almost look kind of plastic. They're non-stick. You don't want them to stick. Okay. I think I have one. I'll try to go look during the break. Okay. All right. Ambulation with rest periods. Y'all know that. Watch the temperature, pain relief. And then of course you're going to pick. Yeah. Yeah, I can't believe you did either.
That was brave.